and welcome to my video where I will be discussing communication disorders, specifically childhood onset fluency disorder and social pragmatic communication disorder. So what is a communication disorder? A communication disorder is characterized by the difficulty producing speech sounds or understanding others when communicating. The two specific types of communication disorder we will be going into are childhood onset fluency disorder and pragmatic communication disorder. Childhood onset fluency disorder is characterized as the repeated and prolonged pronunciation of certain syllables or words, and this can be more commonly known as stuttering. On the other hand, social communication disorder is manifested as a persistent difficulties with pragmatics, such as the social use of communication, in which controls their ability to adapt their communication to a specific social context. It is important to identify the signs in children, as delaying treatment can lead to later developmental risks, such as academic-related problems and catching up with the rest of their peers, or other behavioral and social concerns. In the DSM-5, childhood onset fluency disorder is generalized as the differences a child has in their fluency and other patterns of speech that are atypical for the child's age. More outward signs of a child with this disorder are seen specifically by the repetition of sounds and syllables, broken words, substitution of words to avoid other problematic words, and monosyllabic whole word repetitions. And when being diagnosed, it is important to keep in mind that the stuttering should not be caused by cognitive damages or by any other disease. The DSM diagnostic criteria for social or pragmatic communication disorder identifies this disorder as having problems with both expressing and understanding communication. There are 4 specific areas of difficulties these children face, such as deficits in the ability to communicate for social purposes, difficulties in adapting their communication to a situation, problems following the rules of their spoken language, difficulties understanding other people's inferences. So moving on to prevalence and demographics. Childhood onset fluency disorder constitutes about 11% of children who stutter by the age of 4. It is also seen demographically as being more prevalent among African American and Hispanic children. Considering that pragmatic communication disorder is still quite a recent addition to the DMS, its prevalence is still not yet well known, but about 7.5% of children have some form of a pragmatic impairment. The lack of prevalence rates may also be due to the fact that the diagnosis of children don't usually occur until the age of 4 or 5 in order to make an accurate diagnosis. Treatment types for communication disorders differ depending on the child's needs. For children with childhood onset fluency, a contingency management approach would be beneficial, as it allows parents and instructors to help the child guide them to fluent speech. It is done by using positive consequences for when the child speaks fluently and express negative indicators for when the child stutters. For example, rewarding fluent speech by expressing gratitude while acknowledging a stutter and guiding them through it as well. The second treatment approach are social skill groups intended for those children who struggle with understanding social norms or when it is appropriate to speak a certain way. This can involve implementing role-playing activities with other peers while under therapist supervision to promote social understanding. Family interventions, proving their effectiveness in altering the prognosis of a child, allow for interactive activities to promote the success of the child in their social and academic lives. For parents of children with childhood onset fluency disorder, teaching the parent to speak to their child in a short, concise, and simple manner will help children learn through modeling. Parents should approach this form of treatment with the mindset to reduce any pressure the child may already be experiencing for their lack of fluency. For children with social communication disorder, structuring parent and child playdates can help the child practice taking turns and use appropriate and fluent communication. This leads into creating scripts as an idea to promote appropriate social communication. For example, a parent and their child can reenact a doctor's visit, where a parent can ask the child a series of questions a doctor could ask. On top of all these forms of treatment and interventions, what is critical for the development of these children with communication disorders are their need for family support and promoting self-esteem. Children with communication disorders already tend to have a lower self-esteem by their struggle in trying to speak like everyone else. Therefore, it's important for a parent to instead focus on a child's component of voice or speech and avoid adding guilt on the child's quality and their ability to speak. Being able to reward and show gratitude towards a child working hard to try and surpass their disorder will mean a lot, especially coming from one of their closest family members. Thank you so much for watching this video.